We have a total of 322 spaces that we will have after completion here, and it costs a total of $10 million. That $10 million included some thermal and also the solar up on the upper deck. The design was from the very beginning that the upper deck was at the same level as the main entrance, so that if you need to get into the hospital right away, or if you had a disability where it was harder for you to get mobile, then you could easily get into the facility. Down below here, we didn't have to, but we added the elevator so that if somebody in that capacity needed that assistance, they could, as well as the staircase as well. Well, it's been quite the challenge for parking. We've added the valet service to help with our patients and our visitors, as well as we doubled up our shuttle service, which we've had going for a few years before this started. So that has helped, and we've also created 2 other parking lots for staff as well as visitors, and moved some employees around to other lots so that we had closer parking for our visitors and patients. So the biggest challenge has been the parking and trying to make sure that we were able to service our customers.
It's been a long time coming, and it's a little bit like a school holiday. You really look forward to having it, but you're really eager to have it done too. And by having the spaces open for public use, we can now return some of the employee parking back to employee use that will help deconflict in other ways. And so, yeah, life will get easy for a little while now. It's public parking. There are a few spaces that we've set aside for staff. The upper deck, 14 spaces on the far north row for employees, 9 spaces on that same row on the far north side for volunteers. The rest of it is for public parking. There's designated parking for law enforcement also, so they have easy access in and out. And again, 2 spaces downstairs on the lower level for electric car charging. Now that the parking structure is in place, it enables us to then start on the new medical office building that will be adjacent to the Cascades East Family Medicine building. That'll start in the spring, and that's a cooperative project, Sky Lakes and OHSU, to provide a new space, an innovative space for combination classroom and clinic use. And those plans are evolving as we speak. $50 million project that, like I say, will start next spring.